Dr. Chris here. Today we'll be talking about how to get those hips back and moving. Before we begin, however, we must understand first how our hips get tight, why it is so common, and then why it is important to have proper mobility. See, your body is nothing but a collection of joints stacked one on top of the other. Each joint, then, is responsible for either one of two functions, mobility or stability. Starting with your foot, it is a stable joint in what roots you to your body to the ground. On top of that, you have your ankle, which is mobile, and knee, which is stable as it can only bend and straighten. Next, you have your hip, which is mobile as you can move your leg all around, and then your lumbar spine or lower back, which is a stable joint. And lastly, your thoracic spine or upper back, which is supposed to be more mobile. So with that progression, what happens if a joint is not properly functioning with its given duty? For that, there's a concept called the bad neighbor theory. And what that states is if a joint is not properly operating as mobile or stable, the body will compensate for it at a neighboring joint. For example, if you sprain your ankle, it will become more immobile, secondary to swelling and pain. With this, your body will then ask either the joint above the knee or the joint below the foot to become more mobile. This in turn creates for dysfunction/impairment at all of those joints and can lead to further pain or injury. Circling back to the hip, operating as a ball and socket joint, it is purposed to be a mobile joint with several degrees of freedom. Most commonly, it gets locked up when it is compensating for the low back as well as the knee, which are both designated as stable joints. When the body lacks the proper ability to stabilize those joints, it asks the hip to make up for it. Instability at the knee is extremely common with an active population as it is the main provider of stability with single-leg movements such as running, jumping, or sport-like activities. This is primarily due to glute weakness and a lack of proprioception or knowing where your leg is in space. Instability at the low back is also very common, especially in individuals that sit or stand for an extended period of time. Their body lacks the ability to maintain those positions in a stable fashion, and therefore the hips tighten to help with the stability. So this leaves us with tight hips, which we need to mobilize, and unstable knees and a low back that we need to gain control of. Starting with loosening up those hips, the best way to do so then is with the verteball. With that, areas to focus on are your psoas, or your hip flexor, your TFL, which is at the top of your IT band, your glute med, which is the main stabilizer when standing on a single leg, and lastly, your general glute muscle, which contains muscles such as your piriformis. Now with your hips mobilized, we need to develop the neuromuscular control to help stabilize your knee and low back. For the knee, performing a series of exercises known as glute prep helps cement your ability to control your knee in space. Starting with rotation, single leg, then double leg, kickbacks, side steps, monster walks, and skaters. Lastly, for the low back, developing the ability to utilize your lower abdominal muscles by doing an exercise called the posterior pelvic tilt will help with that lumbar spine stability. With a combination of those two, as well as diligent body work using the verteball, those hips will never get tight again.